Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, immunohistochemistry in breast carcinoma. So, if you see immunohistochemistry in breast carcinoma, here we have the most widely used immunohistochemistry marker in breast carcinoma is actually the most widely used test is ER/PR status. Then, in immunohistochemical analysis is done. In immunohistochemical analysis of heat treated paraffin sections of tumor tissue is done, and this has been mostly done. Okay, when you do this, if you see ER and PR positive status is seen, then this ER/PR positive status will show there will be improved response to endocrine treatment, and thus uh, there will be overall improved survival status is also seen in these patients.
thank you and thank you for watching.